Today, we're lucky enough to have Dr. Paull join us a second time. Dr. Daniel Paull and I talked about 2 years ago, but he is disrupting the healthcare status quo. Anybody who's on LinkedIn is seeing what he's doing on solo practice, and everybody's thinking solo practice in 2023, almost 2024. How does that work? So we're going to talk a little bit about that today. So welcome back, Dr. Paull.
Thanks so much for having me back on.
Yeah, absolutely. Um, how long ago did you start Easy Orthopedics, and kind of what was your motivation to do so?
Gotcha. So I started Easy Orthopedics. We're coming on close to 5 years now. Um, so my motivation, for those who aren't familiar, in my practice, I don't take any insurances. I don't work with any hospital systems. I do house calls. I'm mobile. I see people in offices too. They're not my offices. Any standard stuff an orthopod would do. Most of the surgeries are smaller upper extremity surgeries at this point, but I do see mostly general orthopedics, a good amount of injections. So my impetus for starting, like, I didn't think that this is a practice I was going to be doing, but it was kind of, a lot of things like a calamity of sorts. So I finished my residency in orthopedic surgery, obviously. I passed part one of my boards. I started fellowship, and not to go into too much detail, the fellowship was in hand and upper extremity. It was not a positive educational experience. And so I was obviously very unhappy. So that was going on. And I'm also looking for a job out in Colorado, where my wife is from. And at this point, I've dragged her all over the country, and I like Colorado. I want to go live in Colorado. The problem is, so does every other orthopod on the face of the planet. So, or at least in the United States. So that created a problem of not being able to find a job out here, like anywhere almost. And and then I interviewed for a job back in Connecticut, where I'm from, and it was just this old senior partner telling me how much money he made in the early '90s, and he was so bitter, and everyone was so bitter. And I talked to a junior attending, and I said, "Well, do you like it here?" And he was like, such a depressing response. I was like, "It's getting better." I was like, "What? It's getting better? I mean, you can't live your whole life. It's getting better." So, anyways, the unhappiness in that it created an existential crisis. They formed together into this giant ball of just negative, questionable energy. And I was like, I got to do something different. So I had a friend who started a house call practice down in South Florida. I went to University of Miami for med school. And I'm like, man, this guy's happier than anybody I know. And he's doing really well financially. I'm like, no one's done it for orthopedics, but I think I'm just going to go for it. I mean, it wasn't like a sitting down, calculated, writing out the pros and cons. It was more of like, I'm getting out of this fellowship. I'm not finding a job, like desperation move. So that's what I did. I quit my fellowship. I broke my lease. I moved into my in-laws basement, and then I'm in my own basement now, right? So moving up in the world. But um, that was the impetus of starting it. And I knew I couldn't take insurance because if I did, there's no way it just wouldn't be possible. I mean, if you do that, you need at least 5 staff per doc, and then you're in the whole revenue cycle management nightmare, and you're going to get bad contracts. You're running a high volume practice. I mean, solo practices are not common. They essentially are impossible to run. But if you remove insurance, all that fades away, and you can actually run a very sustainable, good, profitable practice. So that was sort of the impetus. And then, man, from early on, it was just figuring out, like, how the heck do I do this? Where do I find patients? How do I do for an EMR? How do I get supplies? I mean, how do I get malpractice? I mean, I had to figure all that out.
Having to figure everything out is tough, but I'm sure it's been extremely rewarding as well, as you've been doing this for a few years. Uh, what do you think kind of like the biggest challenges are to an established orthopedic surgeon who's fed up, who may want to do what you're doing?
I think probably the biggest thing is, well, fear and salary addiction, right? So I'm coming out of a fellowship. I just quit. I've never had an attending salary. I moved into my in-laws basement. So I was used to not kind of living off a lot of money. And they were nice enough just to really help us out in that beginning stage. But I mean, if you're an established orthopod and you've got a nice house and you've got a bunch of cars and you've got a second house and your kids are in school and you need hundreds of thousands of dollars to live off of, it's going to be really tough to be able to, because whenever you start a business, I don't care if
Mhm.
it's an orthopedics or you have a shop that sells pastries, you're not going to make money for a while in the startup phase. So you have to be able to weather that time of not making money. And if you're salary addicted, which is a weird way to put it, then it's going to be very hard for you to do that because you're not going to be able to just jump into this model and make what you made. I think eventually you can make more, but you have to have this period of like not making a lot. And then also the fear, right? We're conditioned in training that if you come up with a creative, good idea, not in the practice of medicine, more in the system of delivery,
Mhm.
I mean, they really stomp you out for that. I mean, you can have the most silly system practices you'll ever see in your life at a hospital system. And if you do dare question them, you just get stomped. And even as an attending, it's the same thing. So over that course of training, you get a perfectly shaped cog of a doctor who will essentially unquestioningly accept these things that normal people they might not have accepted before their medical training, and that we really shouldn't accept.
Yeah. Well, one of the things and the reason why I wanted to talk to you again was since we last talked, you have, I believe, been doing some consulting time to time with other physicians who are maybe wanting to replicate it, but as well as you have created a course. Can you tell us a little bit about the course that you've created?
Yeah, so I started doing some consulting because started getting a lot of questions about what I was doing, and then after a few conversations where they went on for a long time, and I was just like, I can't just carve out these hours in the middle. They're always in the middle of the day for whatever reason. I can't carve out these hours, and it didn't seem like some people were so appreciative of all this like gold and nuggets and pearls I was giving them. So I started charging for it just to protect my own time, really, not even really to make money. And then as that went on, people were like, "Hey, how do you do this? How do you do that?" And someone's like, "You should make a course." And I was like, maybe that's a good idea. So that's what we did. And it's about 35 modules and tells you how to do everything from how to pick an EMR, how to get malpractice insurance, how to figure out surgery, how to find patients, pitfalls to avoid. And I partnered with Omar Khatib, and he was able to get CME credits. So it's actually generates about 35 CME credits as well.
That's amazing. 35 CMEs. I'm sure a lot of doctors will probably want to take that just because everybody needs CMEs. Um, but I know that you've learned a lot along the way. Just kind of tell us a couple things maybe that you have learned the hard way that would be covered in the course. Give us a couple of examples if you would.
Gotcha. So one is how to price your services. So a lot of docs, we undervalue what we do. We're never used to pricing things out. It's always what insurance dictates. So if you price things too high, nobody will do them, right? Everybody kind of understands that. But if you price them too low, people also won't do them because they think there's something strange. So I've seen docs where they kind of price their services like for less than the price of a copay. And I'm like, you're not going to get any business that way. You need to price it competitively. There's a sweet spot there. But yeah, it's just kind of figuring that out, fiddling with that. Or something else like how do you create an EMR? I didn't know all the EMRs that are out there are built for insurance billing, right? And they're really expensive. So that is like that's not a good fit for me. And I was able to find basically Google Workspace. You can make HIPAA compliant, and I pay $18 a month per user. I have 2 users, and it's like a perfect EMR. I have templated Word documents for all my notes. I generate PDFs, and like it works great. So I mean, there's a lot of these small things like that I figured out. Also like what type of person's gonna give you a good referral and what type of person won't. So you spend the time with the people and developing relationships, or how I managed to get office space. I don't really pay for office space, which people find kind of wild.
So
Um,
how do you get office space?
so I didn't set out to do this intentionally, but the way it basically worked is being a traveling orthopod. I'd find people in town, let's say a chiropractor mostly, or like a primary care doc who are like, well, this guy's got shoulder pain. Do you mind seeing him at my office? And I'm like, sure. So I go there and I see him at their office, and I'm all self-contained, right? So I don't use their coders, I don't use their billers, I don't use their front desk. I'm literally only using that room. I have my own EMR. I'm in and out, right? There's no trace of me there, except maybe some stuff, like supplies in the garbage. Besides you, otherwise you would never know I was there. Um, and for them, it's a value add because they're like, hey, I can't get this guy's shoulder better. Dr. Paul came over and injected it, or they needed A, B, and C, and he took care of it, or, he added a lot of value. And so essentially, I became a value add service. And I found people in the community who respected that and basically will let me pop in and out. And I'm really not using a lot of their resources. I'm not there every day. I'll go weeks in between. I have like 4 or 5 places I go, but they get it. And it's a very symbiotic relationship. And sometimes they'll let me see my own patients there too. They, Like if it's at a physical therapy place, they need physical therapy. That's obviously what I'm going to recommend, or at least I try to. Um, but yeah, there's also people in the community I met who are like, I see when they meet me, they see dollar signs in their eyes, and they're like, "How am I going to make money off this guy?" And my answer is, "You won't. I won't let you."
Right.
So I mean, it doesn't work with everybody. It's it's you have to find the right person. Because it is a value add. How would
Right.
it not be a value add to have an orthopedic surgeon coming into your office to see your patients who are in need of that? That means they don't need to go anywhere else.
Hmm.
If they're at a chiropractor's office, the chiropractor's worried about them leaving and never coming back. This way, you're keeping everything in house.
Right. Well, it's a huge value add to them because it allows them to treat their patients better as well. And I could see as a patient going to my primary care, and if I had an orthopedic issue, an orthopedic surgeon actually came and to that same office, didn't have to go, um, you know, find somewhere new, didn't have to, spend 2 minutes my first visit with the surgeon because they're so busy because they're accepting insurance, correct?
Yeah, that's another issue. I mean, my appointments are booked for an hour, so we can go over, which sounds obscene, right? I mean, but we can go over all their problems, everything they need. So it really works well, this model for complicated patients and who are all and bad historians or both. I mean, gosh, if you have a lot of problems and you're a bad historian, God help you, you will never get good medical care in our system. But the system allows for that. Um, I think, it's and it works. It's profitable, because my overhead's so low. So, I don't need to see 40 people a day. I mean, you can see a tenth of that and really do well with this model if you do it properly, which a lot of people don't really seem to believe. And we were talking about this earlier, where I'm just collecting what I bill. So, if I bill at number X, I'm going to collect almost all of that.
Right.
But if you're an orthopod working in the system, I mean, you're probably creating tens of millions of dollars worth of billing in a year. And you're only getting a small fraction because the insurance doesn't pay what you bill and it gets siphoned off by many other people. So I've just stopped all the siphoning. Um, and that allows
Right.
me to work a lot less because I mean, there's so much wealth in the system. It's really mind boggling. I think the only really good good sense of it I've seen, or way to get a really good feel for it, this is going to sound kind of weird, but the Epic Medical Campus, are you familiar with that?
Vaguely.
So it's I believe maybe it's in Minnesota, and I think it's in Minnesota. If I'm wrong, I apologize. But anyways, they make all the EMRs. And if you have a minute, check out a YouTube video of the Epic Medical Campus. There's like Harry Potter theme buildings, like space theme buildings, and like all this stuff that's like cool, but also very disturbing because you know where all that money's coming from. And I think it's a very like one of the few times you can actually get a glimpse of like what kind of real wealth is like sitting in the system. And it's
Right.
just insane.
Right. All of that wealth created off the backs of physicians. And
Yeah. And
obviously,
everybody else doing the work.
correct. And obviously, hospitals are needed and all that, but there has been a lot of taking advantage of people like you. Um, so kind of another thing that I wanted to point out to people is I saw a quote the other day by an author, Rory Vaden, and I think this fits you perfectly. It says, "We are best positioned to serve the person we once were." And what I see for you is you have gone through the struggle of creating a solo practice, and you have created this course to help other people if they want to kind of go down your road. So to go along with that, knowing that you have learned a lot, let's look into the future. Do you see that this is something that 10, 15 years from now, that even within orthopedics, the subspecialties, a sports medicine person, because you're a general orthopod doing a lot of things. You mentioned injection, hand, probably some sports, but is this something that you see growing and the subspecialty physicians could do it?
I think so. I mean, if you look at, we have to look at direct primary care because they're very far ahead of us on this. So family medicine became so painful to practice that a lot of them just said, we're not doing it anymore. And they started doing direct primary care, where essentially it's like you have a gym membership to a doctor's office and everything's at cost. Labs are at cost. Medications are at cost. So If you don't have insurance or you have a high deductible, not only is the highest quality care you can get because their panels are limited, it's also the most economical. And I use that for myself. So they have like a tried and true model, and a lot of them are doing it and they're popping up all over the country. Now, orthopods haven't hit that quite same pain point yet, but I think in time we will. Take, for instance, joints. I think joints are a big target, and reimbursements are going to get cut continuously for them. The point where docs are making, half as much as, and, in time they'll be making half as much as they were. And so I think to get these subspecialists on, it's a lot of reimagining the value. Like, what is the actual value of an orthopod? We know what it is in the system, but outside of the system, what is it? And that's what I've been discovering. Where a lot of people, if they don't want surgery, if you help them avoid that, they're super grateful for you, and that can also be profitable for you. You don't just need to do surgeries all day, which I think is what I'm seeing. But to answer your question, I think the answer is yes. They might find in the beginning stages, if they're the only direct ortho guy, they kind of have to do more general. Doesn't mean they need to operate on general. They just need to see general. So I think it'll be more that they might be finding they're doing more clinic and less operating, but they'll certainly be a lot happier, and it'll be sustainable,
Right.
Which is the thing. So in time, I think. But if you're a guy who only does left knee replacements, it's going to be harder for you to make that jump.
Right. But even that, I mean, I think that a lot of the times that most orthopedic surgeons, the most fun that they're having is when they do get a chance to operate. And so I think part of that, though, is that, just the way the system has gotten is that being in clinic becomes much more painful every single day because it's not all about patient care. And
Yeah,
I think if you get rid of some of that other stuff, I can see how clinic days could be more enjoyable for someone through your model.
Yeah, I mean, ultimately, you're still helping them in a different way. And also, like, if you're seeing in my model 5 people a day, it's very different than seeing 40 people.
Yes.
And then you, at the end of the day, if they're all cash pay patients, which you can't take insurance in this model, I mean, you're already paid for that. You're going to feel a lot different than how you feel like just milling through 40 people a day, and all this paperwork, and you're trying to get things approved and they're not getting approved. And yeah, certainly when you're in the operating room, all that kind of noise kind of disappears and you can focus on what you want to do, which is patient care. But I would say in this model, it's the same sort of thing in clinic. So clinic really doesn't become so unenjoyable. It's very different than the clinic that they might be used to, which is a lot. It's hard, it's a lot to do. It's not as opposed to your handful of cases where you can, I'm not saying relax, but remove the noise.
Right.
You can hit more of a zen in there.
Yeah. Well, Dr. Paull, I really appreciate you kind of bring us up to speed where you are and the ability to talk about the course. If there's someone who has watched this that wants to connect with you, maybe learn more about the course or have more specific questions about how you're doing things, what's the best way for them to reach you?
Gotcha. So for the course, if you go to insurancefreemedicalpractice.com, that'll take you right to the course where you can purchase it. As far as connecting with me, you can email info@easyorthopedics.com, or I'm on LinkedIn. Like, if somebody has a simple question, just how do you do A, I'm happy to answer it on that platform. I'm happy to do that.
Yeah.
But that's the best way to find me.
All right. Thank you again, Dr. Paull. I love what you're doing. I look forward to your posts because you are talking about things in a unique way, different way. And that's the only way that we bring change, whether it's small change or big change, is people talking about it. So I appreciate you.
Yeah, thanks for having me on.
You're welcome. Have a great day.
All right, you too.